Give it a try. That is the magic that happens between a doctor and a patient.
Dr. Koseff, with over 35 years in clinical medicine, you've seen healthcare evolve dramatically. What was the specific gap in patient care that made you realize a platform like Avee was necessary in British Columbia?
Wow, that's a good question. So, times are changing. People's needs are evolving, and there are big gaps in healthcare delivery, and Avee fills a lot of those gaps.
How so?
Well, when patients can't get appointments, when patients can't have access to a family physician, Avee finds and fills those gaps efficiently and quickly.
You know, we often hear that virtual care lacks the human touch. How does Avee ensure that patients still feel heard, respected, and cared for?
That's a good question. So, when physicians see and speak to patients, that is the magic that happens between a doctor and a patient, and that can occur in person, it can occur over telemedicine, and it can occur via email.
If someone is hesitant to use telemedicine, what is the one thing that you would do to ease their concerns and reassure them that it's okay?
Give it a try. We're gonna not disappoint. We're gonna make the magic happen.
What about the diagnostic accuracy of it, though?
Okay, so in order to make an accurate diagnosis, a physician has to speak to a patient and take a good history. Sometimes a physical examination is necessary. So if a physician is comfortable that a physical examination isn't necessary, they can make an accurate diagnosis. They may need to organize some investigations like blood work and other types of imaging, and then make a diagnosis. But accurate diagnosis can very much be made.
Let's talk about a story where Avee's same-day access made a critical difference in a patient's health outcome without using any names. Can you provide some examples of something that you've dealt with?
Yeah, I can tell you one that happened to me just recently. I had a patient who had significant symptoms. He was going to be traveling within a week for his job, and literally within 2 days, I had blood work done, I made a diagnosis, and I had him see a specialist within 4 or 5 days, and he was still able to make his trip the week after.
And how serious were his conditions?
He has a significant diagnosis.
As the medical director, you oversee over 200 physicians. What's the most common feedback you hear from doctors after they have transitioned to Avee's platform?
We absolutely love this program. The technology is fantastic. Why didn't I hear about this sooner?
What difference has it made in a doctor's scheduling, though?
So, we all have a shortage of time these days. Doctors need to make their time important and fill their time at their ability, at their optionality effectively, and Avee enables them to do exactly that.
How do you maintain high clinical standards and quality assurance when your doctors are working remotely across the province?
We have a very good way of observing what our physicians are doing, and we also track patient feedback very carefully. So we monitor the capacity and the quality of our care.
How does the flexibility of Avee help prevent physician burnout?
That's a great question. The magic of Avee is it gives physicians the opportunity to choose when they work, how much they work, and they're driving the car. They're the pilot.
Let's talk about the strict clinical boundaries for Avee. How do you train your doctors to recognize when a patient absolutely must be redirected to in-person care?
Look, doctors are trained for many, many years in medical school, in residency programs to learn exactly that. At Avee, we just have to make sure that they do a good job.
Let's talk a little bit more about AI and the human evolution. How are you seeing artificial intelligence integrated into Avee's clinical workflow over the next 5 years?
The magic, the benefit and the sweet spot that Avee has is that all of the technology works in the background, and it enables doctors to see patients and do what they're trained to do. So AI is a huge part of hooking up doctors and patients, but it runs in the background.
How does Avee protect the privacy of patients?
We adhere to industry standards, and we are completely compliant and familiar with what we need to do to protect patient information.
How does the platform integrate with pharmacies and streamline it for patients?
So we have over 600 pharmacies throughout the province that we are affiliated with, and they have access to our system, and it makes the process of seeing patients, booking patients, sending them prescriptions seamless.
Is this better than faxing, or is there a level of faxing
There is a
involved?
level of faxing, but there's a level of AI which runs in the background that makes it seamless.
Okay, let's talk about how the Avee for Pharmacies program specifically improves medical adherence and the overall patient experience.
So the way I think it really does that is many patients haven't heard of Avee, and if they see a pharmacist and are telling the pharmacist about an inability to see a physician or some symptoms that they're having problems with, pharmacists will often refer to us and make that doctor-patient interaction happen quickly.
In a way, pharmacists are facilitating their relationship.
Absolutely.
Okay. Let's talk about the bridging the communication gap between virtually prescribing doctors and community pharmacists, and how did Avee solve that problem?
So in a lot of pharmacies, especially in rural areas, they are out alone, and with physician shortages, they're often left dangling. And our services significantly help those pharmacies.
In your view, how is the role of the community pharmacist changing as a virtual primary care becomes more prevalent?
Wow. I'm not sure I'm qualified to speak as a pharmacist.
No problem, let's leave that one. How is Avee actively working to alleviate the current strain on BC's emergency rooms and urgent primary care centers?
Yeah, that's a great question. So typically what happens when patients have some symptoms and are unable to access a physician, they often end up going to emergency rooms and walk-in clinics. And if they are able to have a quick, brief discussion with a physician, sometimes the issues can be taken care of and congestion in emergency rooms can be alleviated.
But on the other hand, you are also sending patients to ERs when it's necessary, am I correct?
Absolutely. If a patient has a medical urgent problem and needs urgent care, we will facilitate that referral.
There's an ongoing debate about private virtual care fragmenting patient records. How does Avee ensure the continuity of care and communication with the patient's primary care home?
So if a patient has a regular family physician and they ask us to send the notes, the charts, the investigations, we make sure that that happens.
Let's talk about the ideal collaborative relationship. What does it look like between a platform like Avee and the public provincial health authorities?
So I think the ideal relationship is we fill the gaps. We make sure that patients can be seen on time, efficiently and quickly. And at the same time, if we need to access provincial health services, we do so in a very effective manner.
Let's talk about healthcare equity. So often we hear about rural areas or non-urban centers lacking a family physician, lacking a lot of resources. How are you serving the underserved population?
Very good question. So especially in rural areas where there are physician shortages, we're making a big difference, enabling those patients to access healthcare services, to access seeing a physician on time, quickly, efficiently, easily, simply.
Do you think that this model should be scaled right across the province, right across the country?
We're certainly trying to do that.